Dear students, today our class is the home. In home visit, we will see all those content like introduction, history of healthcare, home healthcare, concept of home visit, principles of home visiting, steps of home visiting, and advantages of introduction. The home visit is the ideal place to provide proper care to the needy person. Home visiting is very essential in community health nursing. Mainly, it is the backbone of community health nursing. The benefits of home care based on familiarity and being surrounded by family. Coming to the next point, the client can be empowered as choices involving food, treatment, medication schedules, interacting with family, friends, leading to a feeling of security and well-being. So mainly the home visit is the ideal place to provide a proper care to the needy person. Mainly those who are all needy person, for them we are giving the care. To their home itself we are going and we are giving the care. And mainly the patient will or the client will have a choices involving food, treatment, medication schedules, interacting with family, friends, leading to a feeling of security and well-being. Mainly the client will have his family members, food, treatment, medication schedules, everything the client will have within his house setting, with his home setup, so he will feel a security and well-being. Coming to the history of home health care, so how this home health care were initiated. The home health care started in India during British period, mainly in 18th century, during the period of 1757 to 1947. It was begun in India by the foreign missionaries with efforts to train dyes and midwives to conduct the deliveries in home setting. Mainly by the foreign missionaries only this home health care were initiated. Why? Because during that period there are n number of death rate and disease rate were present in the community area and within India only mainly. So for managing that, they were initiated this training to dyes and midwives to conduct the deliveries in home setting. Mainly to conduct the deliveries in home setting, they were given trained by the foreign missionaries. In 1918, Lady Health Visitor course started by Government of India at Delhi. So this is the main history of home health care. Next we will see about concept of home visit. So what is our concept in home visit? In India, as a community health nurse, he or she should have a weekly fixed program in different areas and village. Mainly she will have a fixed program in different areas and villages. In case of emergency, tentative visits can be planned and arranged. So if any emergency means, she will plan the program according to that convenient. Then coming to the next point, her visit should be included the following services. So mainly her visits will focus the specific category of people. So those who are all, first one is pregnant mother, intranatal mother. Intranatal mother means mainly during the delivery, that is intranatal. Then postnatal means after the delivery, so after the delivery the mother will be present. Then newborn care, then infant care, who is infant from birth to 1 year of the age. Toddler care, so who is toddler from 1 year to 3 years of children. And preschooler children, so who are all preschool children 3 years to 5 years. Then Anganwadi, in Anganwadi there will be a children's the age between 1 to 5 years. Then coming to communicable disease and non-communicable disease, these are all the services the community health nurse will focus. This is about the concept of home visit. Principles of home visiting. So what are all the principles are present in home visiting? We will see one by one. The first one is home visiting should be made according to the need of the people. So first thing is we have to see for the need, who are all the needy person, to them only we need to give the care. So this is about the first one. According to the need of the people, we should plan the home visit. And second one is it should be part of a planned visiting program. Second क्या है? So we should have a planned visiting program. And third principle is collect background information. We should always collect the background information from the family. So the information mainly include family size, occupation, income, religion, resources, customs and culture. So this is the third principle. And fourth one is identify the health problems of the family. So we have to identify the health problems of the use safe technical skills and nursing procedures. So we have to use a safe technical skills and nursing procedure. So after identifying the health problem, whatever the problem we have identified, according to that we have to go for our nursing procedure. Example, if the female or if the male is having some kind of signs and symptom like having diabetes mellitus, means we can go for the urine sugar test. So according to that, identifying the problem, we can use the nursing procedure. The next sixth point is in health teaching, be sure of what you discuss, that is scientific soundness. So while you are giving health teaching, you should focus on the topic. So what you are discussing, that you should know. Be sure of what you discuss, that is scientific soundness. You should give the health education very effectively. And seventh one is the approach to the family should be kind and courteous with the view to gain their confidence. Always you should have a kind and courteous approach towards the family members, then only they will have a confidence over you. So this is about the principles of home visit. Next we will see about steps of home visit. So when you are going for the home visit, what are all the steps? One by one we can see here. The first one is plan the home visit. First, for each and everything, planning is must. So here also first one is we are planning the home visit. And second one is after planning our home visit, we are arranging and equip the community bag. So make sure your community bag is having each and every articles to go for home visit. And third one is approach the right family. So right family means we will see later here. Then fourth one is interview, and fifth one is intervention, sixth one is closing of the visit, and seventh one is recording the visit. So this is about the steps of home. So first one is plan the home visit. How will you plan your home visit? As a community health nurse, you should the total knowledge of the problem and care needed by each family. That means know the physical setup, cultural background, practices, beliefs, available resources, level of understanding, socioeconomic condition of each family and their relation, and prioritize the care. So as a community health nurse, you should know all about their problem. Mainly you should have the knowledge of problem and care needed by each family. So in house number 1 this kind of problem is there and they are the needed family, and in house number 2 this kind of family members are there and their problems is that, and we can do that. Like that you should have a plan. So for each and every family members you should have a health problem and their needed thing, that all things you should know. Mainly physical setup, cultural background, practices, beliefs and available resources, and their level of understanding, socioeconomic condition. For each and every family within the community area you should know about that. community bag. So depends upon the care through many procedures, we can arrange the community bag. Example, hygienic care, taking height and weight of under 5 children, checking vital signs of the client, assessment of pregnant women, testing the blood, urine and sputum, conducting deliveries, immunization of pregnant women, etc. So according to the procedure, we can arrange or we can equip the bag priorly. So before going to visit only, we have to arrange the bag, because after reaching the patient we cannot tell we are having missed articles, I don't have this articles, I don't have this material, like that we cannot tell. So before going to the community, before going to the home visit itself, we have to arrange and equip our bag appropriately. And coming to the third step, approach the right family. So you have to, first you should plan, next you equip the bag, and you have to approach the right family. So when you are entering to the home, you should not go inside the home just like that. So before that, knock the door, you should knock the door and introduce yourself, inform the purpose of visit if it is the first time. So if you are going to the home first time means you should knock the door and you should introduce about yourself and for what purpose you came there. So that purpose also you have to explain them, and establish rapport, maintain the level of understanding. You should have a communication, you have to maintain a communication, and you have to assess their level of understanding. And next is be calm, polite and friendly. Always you should be calm and polite, friendly, so then only they can able to speak and they can clarify their doubt. The next is being a good observer, assess the family and background, problems, needs, etc. So you should have a you should have a observation skill. So here in home visit you should be a good observer, then only you can identify the problems and needs of the family. And next is listen their problem with eagerness and should not force them. So you should listen them with eagerness, so what they are going to tell and what they are telling. So you should have eye to eye contact and you have to sit in front side and you have to listen them very eagernessly. So this is about the approach the right family. And next is recording any information. If they are giving any kind of information, so you should record it during the home visit only. Then understand their customs, maybe good or bad. Make action according to the needs of the family. So according to the need you have to make action. The next is interview. So first you plan the thing and next you equip the thing and next you approach the family. Then after that, after approaching, you will take a interview. So interview can be defined as a conversation with a purpose. The goal and objectives of interview must be informed as early as possible. So mainly interview means we are having a conversation, mainly we are sharing some kind of ideas. It is an exchange of ideas and views between two people. The interview tool must be prepared well in advance. If necessary means you have to prepare a interview tool. Interview tool is nothing but you will have a question. So what is your name, what is your father name, do you have any history of disease, past medical history, past surgical history, like that you will have a some kind of question with you and you will ask the question according to the need of the people. So this is about the interview tool. The next is the community health nurse should be sensitive to other feeling with respect, should collect the real facts through interview technique. While conversation only, you should be sensitive to others feeling, what they are telling, what they are going to tell and what is their actual problem. So all those kind of things you should observe in a proper. Next we will see about principles of interview technique. So what are all the interview technique in that, how you will follow the principles? So we will see one by one. First one is a community health should have established good rapport. So first one is you should maintain a good rapport or communication with the patient. That is very very essential. Then second is he or she should take informed consent. So if any procedure you are going to do, or if research purpose you are going to conduct any interview, means mainly you should take a informed consent. Then third point is provide privacy when conducting interviews. So always you have to talk to the patient in a private area. So you should not speak in a public, it will interrupt the communications. Then coming to the fourth point, maintain alertness and shows positive attitude towards the client. So you always should have a positive attitude towards the client. You should not show any kind of negative attitude like poor facial expression or any hesitation, like kind of thing you should avoid. Then fifth point is be a good listener. So you should always a good listener to the client and her family. Coming to the sixth point, should go down in the level of understanding. So you have to go down to the level of understanding of patient. According to the patient level of understanding, you should go down. Then seventh point is should know understand the total background of the family. So already we have seen this is very very essential to know about the family background, so that also you should understand. Must conduct in a fully relaxed manner. So you should not have any kind of stress or any rigid moment. So you have to conduct a interview in a relaxed manner. The ninth is in a continuous manner step should follow. So during interview your flow of speech should be in a continuous manner. You should not have a break and you should not have any kind of interruption. So it should be in a continuous manner. Then 10th one is record the interview properly. So what are the important things are there, so you should record it in a proper manner. 11th point is evaluate the problem. So during the interview, so what are all the problem was faced by the client, so that thing you should evaluate and you should record it also. And 12th is reassess the interviewed client and family. So you have to reassess and you have to focus on that interview in a correct manner. So this is about the technique. And next is intervention. So fifth steps of home visit is intervention. So what is meant by intervention? In nursing diagnosis also we are having intervention. So what we are doing, our action is we are doing procedure is called a intervention. Mainly assess the client family thoroughly. So we have to assess the client or family thorough manner. Then next is make a nursing diagnosis in a constructive manner. So here we can make a nursing diagnosis also. Then plan nursing care procedure according to the needs of the family. So what is the need of the family, according to that we will start with that procedure. The next is provide nursing care with comfort. So we can give any kind of nursing procedure according to the need. Then next is prepared or make sure with the resources which is available in the community bag and community setting. What are all the resources available within the community bag and community setting, according to that you can go for the procedure. And assure the client family appropriately. Then next is evaluate the care with the objectives. So what are all our objectives, according to that we can evaluate our care. Then record the provided care properly. So for each and everything you should record the procedure in a proper manner. Then sixth point is sixth steps of home visit is closing of the visit. After doing intervention, after our procedure has completed, then we have to closing of the visit. So usually a community health nurse starts her visit by 9 a.m. in morning and ends by 2 p.m. in afternoon. The regular visit include important houses, specific need-based houses. So mainly her focus is mainly important houses. She will not cover all houses. Mainly she will cover many important houses and specific need-based houses. Example, antenatal term cases, pregnant women. Then intranatal cases during delivery or neonatal, postnatal, mainly newborn care and after delivery cases. So family planning cases, old age care, Anganwadis and schools and leaders houses during planning the program. So these are all her regular visit. Mainly specific cases, need based cases only she will visit the houses. And next is community people will have an understanding and coordination with the nurses, fixed days visit and objectives of the visit. Once community people knows about this community health nurse means they will have a understand and they will have a coordination with her activities in a fixed day visits. And if there is any programs, she will inform the advanced date, place, venue, etc. If she will conduct any kind of program like immunization program or vaccination program, so she will inform in advance date, place, venue to the people over the community area. So this is the closing of the visit. Coming to the recording the visits. So this is the 7th step of record home visit. So recording the visit is very important. So how far you are giving the care to the patient, how much you are giving the care to the patient, how many patient you are meeting. So all those things you will record it in a daily basis. After the visit to a particular area or village, community health nurse should record the events. Example, eligible couple register, birth register, immunization register, malaria blood smear register, death register, antenatal register, postnatal register, family planning method register. There are n number of registers she will maintain. In that she will record. Example, today if she went for any house with the eligible couples, so she will enter to the eligible couple register. Or if she conduct any kind of birth, so she will enter in the birth register. Or if she went for any immunization program, then she will enter to the immunization register. So like that she will maintain the n number of registers with her. Then she should write the daily of the visit and the achievements, advantages, disadvantages. This is the recording the visit. So far we have seen about these steps of home visit. 7 steps we have seen. So next we will see about advantages of home visit. So what are all the purpose or what are all the advantages of home visit? So first one is, as a health team members, she can meet the peoples in their own setting. So patient can be meet in their own setting itself. Then next is, one can assess the real problems easily. So when we are going to the family, when we are going to the community setup and going to their own home, so we can understand their real problems easily. Then third point is, she or he can plan the problem solving approach along with the community people. So with the help of community people only we can solve their problem. Then fourth one is, it will create approach relation between a nurse and family members. So it will maintain a relationship between. Then fifth point is, home visit provides an excellent opportunity to implement the nursing process. So we can implement the nursing process in an effective and excellent manner. Then sixth point is it is convenient for the client to discuss their problem and solving the problem easily. So it is very convenient because client is there in the home setup, so he will cooperate with along with their family members, so it is a convenient for the client also. And seventh is health teaching will be more clear in the home settings and prevent more problems. So in their home setup itself we are giving health education, so it will be more clear. Then eighth point is it will be reduce the acute shortage of health providers and decreases the nurse patient ratio. So we are going in people's house and we are giving care, means mainly it is reduce the shortage of health providers. The ninth point is the family people can recognize the responsibility and practice of a health team members. The family members also they will recognize their responsibility and they can able to understand the practices of health team members. Then 10th point is as a health team member it provides an opportunity to look for potential problems or upcoming needs. So we can able to understand what are the upcoming needs and the future problems. So these are all the advantages of. For more reference you can refer Thalassemia PM Procedure and Theories of Community Health Nursing, JP Brothers Medical Publishers Private Limited, and Parke Essential of Community Health Nursing, Banarsidass Banot Publishers. Thank you.